I'm here with Jerry Matczak. Jerry, thanks so much for joining me. Please tell me a little bit about the work you're doing with patient-centered clinical research.
Yeah, thank you. So the traditional model of clinical research has been very drug-focused and science-focused. So you've had very, very brilliant people trying to identify how to create clinical trials so that people will join them and participate in them, and so that they measure things that can make people's lives better. But what's been missing in that equation to some degree is the voice of the patient, is the knowledge of the patient to design and execute trials such that it will deliver the value that's needed ultimately in an approved drug.
What is that process, just for a layman?
Sure, so that process is the process by which a drug candidate gets proven in patients to be safe and efficacious, which is a fancy way to say it's safe to take and it works.
Why would a pharmaceutical company give two hoots about patient engagement?
We want to be more efficient in executing clinical research. We want it to be quicker. We want it to be faster. We want it to be better from a patient perspective, because ultimately patients will leverage these treatments to make their life better. And so to do that more efficiently is a win for everybody. Patients, in an ideal world, would get treatments faster that work better. And we'd be able to do that on a regular basis. Too often drugs fall out in the clinical trial process after lots of investment in time and money. And we want to see that improved.
Have you used social media at all to engage with patients?
Yeah, so fundamental to my work and my role is to be as open and public and as social as we can be with a lot of the information that we talk about. So I run a blog and our Twitter for our handle. It's how we've got connected, frankly, with Medicine X. We've got to know e-patient advisors, and we've met them in person, and we've worked on workshops together. We've brought them into the walls of Lilly where they've live tweeted their perspective on clinical research. It was a bit of a groundbreaking thing, sort of a non-lawyered up session where we're hearing directly from patients. Those are all good examples of social media being fundamental, I think, to our process. Without social media, we would not be here today. We would not be as attuned to what patients want in clinical research.